Hello everyone, my name is Dr. Joel Rosen and I wanted to create a video for you today in regards to a conversation I had with a friend of mine at the gym. He came up to me and he said that he knows that I work with children that have ADD, ADHD, and he was concerned about his child potentially having some of these behavioral problems. And we just discussed some of the things that I think he should look at before he really determines the extent of his child's problem, and before really going down that road of getting him tested, having him diagnosed as an ADD and or labeled, getting him on medications, and some of the things you need to really be aware about. And I thought, what better an idea than to post this video so that you can understand a little bit about what you may need to do if this is something that you are dealing with yourself. So some of the things that I wrote down here are, number one, foods. It's very important to understand that if your child has some behavioral problems or lack of focus or lack of concentration or just has some attention deficit concerns, is that there may be a problem with the foods that he's eating or she's eating. Specifically corn, soy, gluten, dairy, and eggs. Those are the most inflammatory type foods that you'll see. And when I say inflammatory foods, it's not like they have an allergy to it, where if they eat it and they do a skin fold test and they find that they're reacting allergically right away. That's a different type of reaction. We're talking more about a delayed reaction or an intolerance. So what happens is the foods that the child eats, typically these foods become unrecognizable by the immune system, and or the immune system is chronically challenged, and every time the child eats those foods, the child is reacting with inflammation, and that inflammation in the bloodstream goes to the brain, and then that creates focus and disturbance problems. So one of the things you can do that would be very, very helpful is try to remove these things: corn, soy, gluten, dairy, and eggs. It's really, really hard, I know. How are you going to get your kid who doesn't eat very many foods to begin with to get off of those foods? But I think you're going to find that the ends justify the means. You may have to be militant about it. You may have to have a couple of episodes where they don't leave the table until they eat, or they go to bed hungry until they realize that they need to eat something. That's the battle you're going to have to pick, but is that a battle you want to pick versus having them on Adderall or a stimulant or some kind of amphetamine, which short-term wise is okay, but from a long-term solution, it's not going to be very, very helpful. So be aware of those foods, and those are typically seen in processed foods, packaged foods. I mean, really you want a whole food-based approach where you're eating healthy meats that are organic and low-fat, and or you want to eat healthy representation of fruit and vegetables. I know your child, right? What I do in the morning is I make a smoothie and I put fresh berries in there, I put almond milk in there, I put some coconut butter in there and flax, and I put a little bit of hypoallergenic pea protein in there. And they don't like it that much, but there's enough sugar in there that's cut with a little bit of dietary fat and protein for them not to dislike it too much. And you know what? Too bad. I'm the father and I'm the parent, and they're the child, and they got to eat it. The next thing that we see is loss of immune tolerance. A couple things that you may not know, but if you have a child who didn't go to full term, was a C-section baby that didn't pass through the canal, the vaginal canal when they were born, and was not breastfed to term, then their immune system is going to be compromised. As well is the mom's immune system prior to conception or during conception, if they may have had gestational diabetes, if they had adrenal problems or their own immune concerns, then your child is going to have heightened immune problems. And the immune system is really what fights off infection and also creates inflammation. And so when we have someone that hasn't had proper exposures to proper immune boosting processes like passing through the vaginal canal or having the breast milk or having proper dietary removal of proteins proteins that you're reacting to, then the immune system is going to be challenged. And there are certain things that you can do, like colostrum. There's a great supplement that you can use. You can use probiotics. You can use healthy bacteria. Small chain fatty acids are really good. So those are things that we talk about in our office that will be really helpful to help stimulate the child's immune system. Because 80% of the immune system is in your gut, then typically this goes hand in hand, and that's when you have a child. I had a child of a friend the other day, and the mother brought her in, and she's suffering with a lot of abdominal distress. She's got some immune compromise, and there's certain things that you can do to help that. And again, we get into probiotics, we get into colostrum, we get into immune enhancing supplements that will be very, very helpful. Lastly is blood sugars. I mean, I think this goes without saying. If your child is missing a breakfast, if your child is having high sugary carbohydrates and sweetened cereals and sugary milk for breakfast, or they're missing their lunch, or they're not eating again till like 5 o'clock in the afternoon, and then they have again high sugary foods, then that child's sugar levels are going up and down. And you'll see a lot of the times, if you can control your child's sugar levels, then they're going to have a lot more focus, a lot more concentration, a lot less behavioral disturbances. So, I mean, that makes sense. You need to make sure your child is stabilizing their blood sugars throughout the entire day. And that means having a healthy representation of a protein, carbohydrate, and fat per meal, making sure that no longer than 2 to 4 hours pass by between your meals. And I wrote here that blood sugar levels should be anywhere between 85 to 99. A lot of the times I'll look at children's blood sugar levels and they're way too low or they're way too high. And a lot of the times they're actually insulin resistant at such a young age, and they have a pre-diabetic condition. So there's a lot of things you can do naturally to help your child. I hope this video was informative to you. And if you want some help with your child and they're looking for an alternative solution for ADD, ADHD, behavioral disorders, then please think about my office and the natural approaches that we take. A good number to call us is 561-883-0090, and let them know that you want your child to be evaluated from a functional medicine point of view. I hope this was helpful, and I look forward to seeing you soon. Thank you so much.